Amyotrophic lateral sclerosis, or ALS, is a motor neuron disease that attacks the nerve cells that communicate between our nervous system and our voluntary muscle movements, like those in our arms, legs, and face. Understanding the name a bit more can help understand the pathophysiology of the disease. The reason it's called amyotrophic lateral sclerosis is because the A in ancient Greek means without. Myo refers to muscle and trophic to nourishment. Lateral is the location of the spinal cord affected, and sclerosis means hardening or scarring. When a muscle has no nourishment, it atrophies or wastes away. In ALS, the motor neurons are attacked and eventually die and harden, causing the muscles they no longer communicate with to degenerate and eventually atrophy. ALS is also known as Lou Gehrig's disease. Lou Gehrig was a famous baseball player who was diagnosed with ALS. When a person has ALS, motor neurons degenerate and eventually die, and so they stop sending messages to the muscles. When this communication is stopped, all muscles that are under voluntary control will lose their ability to move, and then will lose their strength, weaken, and shrink or atrophy. As the disease progresses, the brain will eventually lose its ability to control voluntary movements. ALS is a rapidly progressive disease, although the rate of progress can vary with each person. The average life expectancy of someone with ALS is about 2 to 5 years, but it is possible to live longer. About 10% will live more than 10 years, 25% will live 5 or more years, and 50% will live 3 or more years after diagnosis. ALS is a terminal neurological disease. Most people diagnosed with ALS eventually expire from respiratory failure when the chest wall and diaphragm muscles are affected. ALS usually does not impair cognitive abilities, nor does it adversely affect the 5 senses of sight, smell, hearing, touch, and taste, but because cognitive abilities remain, a person with ALS may become frustrated or anxious or depressed because they're fully aware of the progress of the disease and its effects on their body. Individuals diagnosed with ALS usually maintain control of eye muscles and bladder and bowel functions, although in the late stages of the disease, most individuals will need assistance. So let's review some of the signs and symptoms of ALS. The early symptoms vary depending on what part of the body is affected. It usually involves muscle weakness or stiffness. Initial symptoms are most commonly first noticed in the arms and legs, called limb-onset ALS. The limbs are affected first because the upper motor neurons and the lower motor neurons in the spinal cord are dying. If a person has limb-onset ALS, the first sign of symptoms can be subtle cramps, spasticity, or tight, stiff muscles. And they may find that they start to trip more often, or the person may find it difficult with their fine finger dexterity, like writing, typing, or while getting dressed, buttoning their shirt. In bulbar onset ALS, the muscles in the face, mouth, and throat are affected first because the motor neurons in the medulla oblongata, what used to be called the bulb in the brainstem, start to die with lower motor neurons. The first sign of symptoms can be slurred or nasal speech. Although the early symptoms may vary as the disease progresses, a person with ALS will have muscle weakness and atrophy that spreads to other parts of the body, and they eventually will not be able to use their hands, arms, and legs. Problems swallowing or dysphagia will develop, as well as dysarthria, problems with speech, affecting their ability to communicate, and they will have difficulty swallowing and chewing, increasing their risk of choking. When the upper motor neuron is affected, the person experiences spasticity or hyperreflexia, exaggerated reflexes, and lower motor neuron damage will show muscle weakness, cramps, atrophy, and fasciculations, or very fine twitches. How is a diagnosis of ALS confirmed? ALS is very difficult to diagnose because there's several diseases that have similar symptoms. It takes multiple tests and procedures to confirm the diagnosis. Tests such as a spinal tap to test the cerebral spinal fluid, muscle or nerve biopsy, x-rays, MRIs, pyelograms of the cervical spine are frequently used to reach a diagnosis. To confirm the diagnosis of ALS, signs of both upper neuron and lower motor neuron damage must be present. What are the causes of ALS? Scientists still haven't discovered what causes ALS. In 90 to 95% of what they call sporadic ALS cases, it seems to occur at random. The most common age of onset of ALS occurs between 40 to 60 years old and occurs more frequently in males. Approximately 5 to 10% of ALS cases are what they call familial ALS or inherited ALS. Only one parent is needed to carry the gene for this disease. What is a cure and treatment of ALS? No cure for ALS has been found, but there are treatments to help relieve symptoms and improve quality of life. In 1995, the FDA approved the first drug treatment called Rilutek. This drug is used to help reduce the damage to motor neurons by minimizing the release of glutamate. Glutamate, or glutamic acid, is the most abundant excitatory amino acid, a small molecule neurotransmitter in the central nervous system. It's thought that when the nerves in the brain and spinal cord receive too much glutamate, it causes damage. Rilutek is used to limit glutamate release and the damage to the motor neurons. However, limiting the release of glutamate does not reverse any damage already done, but it can help to slow down the progress of the disease. Additionally, physicians can prescribe drugs to help with some of the symptoms, for example, easing muscle cramps, pain, and depression. Physical therapy can help strengthen unaffected muscles through exercise or stretching, and this can reduce spasticity of the muscles. Speech therapy can help with communication, even nonverbal communication methods, if or when necessary. Occupational therapists can work with patients to remain mobile by means of wheelchairs, walkers, or braces. And they work along with social workers and nurses as a team to help relieve symptoms and improve the quality of life of someone with ALS. Research is still ongoing, and hopefully advances in science and neurology will result in an eventual cure for ALS.